Well, hello there. It is Nancy Coy with your Tuesday patient lending tip. Today we are going to talk about the 5 patient touch points as it applies to patient lending. So the first one is your website. You want to have a banner on your website that says payment options available, payment plans available, whatever you're comfortable with, but you want to have that on your home page. Why? Because when patients find out that you have methods and options for them to pay for care, they will come to you over somebody else. There's a lot of websites that have financing options available, but they're pretty hidden in the on those sites. So first thing again is websites. The next thing is the clinician handoff. After the provider has met one-on-one with the patient and completed the diagnosis, it's ideal that the provider introduces the next person, treatment coordinator, office manager, whoever is going to be the one who's going to handhold the patient through how they're going to pay you. And when you physically take the minute to introduce the patient to the treatment coordinator or office manager, whoever's taking on that role, that sort of baton handoff is really smooths out the process. Why? When you introduce, let's just say for simplicity, let's say it's Alex. I want to introduce you to Alex. She's going to take it from here. Patients trust you, and trust converts. When you tell the patient or instruct the patient that the next step in the process is to talk to Alex, that shows a continuity of care and it shows a smooth process. Now, when Alex picks up the baton, if you will, she needs to present the options that are available for the patient to pay you. And that is usually, we always suggest options where the patient can pay you with cash, credit card, whatever, insurance, of course. And if there's an out-of-pocket portion and the patient can't pay you in full, we obviously treat or teach your team to appropriately, within regulatory compliance, offer financing options. And you need to have a plethora of financing options because not all the diagnosis that you're offering patients is the same. Not everybody's going to qualify for one type of loan product. We need to have a few. So Alex goes through that presentation. I do want to say that there's 3 states that we have to be a little careful how we do this. And that's California, Illinois, and New York. But we want to guide the patient through their options and we want to help them. We want to provide them with access. We want to provide them with hope, never selling anything. If we can guide them through the application process, that's ideal. However, in those 3 states, the patient must complete the application process by themselves. Now, the other thing you want to do is make sure that the patient and whoever is going through the presentation and the guided application process is in a consultation area, not in an open forum in front of a bunch of other people. The patient is talking about personal information and it's inappropriate. In fact, there's a regulatory, it's called UDAP, and we want to make sure that we're staying within regulatory compliance. And one of the ways to do that is make sure that our treatment coordinator, office manager, whoever's having this conversation can do it in confidence with your patient. And that may just mean, if you have a smaller office, that may be just that they need to go off together in an area where they can have a conversation. And we call it ears in the cornfield. Other people can't hear what the dialogue that's happening. Now, what happens when the patient wants to think about the transaction? They want to think about, maybe they want to go home, talk to a spouse. Maybe they just want to think about, should they be doing this or not? No problem. But what we want to do is set up a follow-up with that patient. We want to set up a time to talk to the patient and follow up with them. The patient at that point does not feel like a number. They are now committing to have a conversation with you, and whether that's the patient's going to come back to the practice and meet with Alex again, or if the patient is going to go through the loan process or have a conversation over the phone, we can do it that way. There is a multitude of ways to execute, but we want to make sure that we have a follow-up. Just letting somebody walk out the door and saying, go think about it. No, we need to follow up with these people and we need to close the gap on the treatment that you have prescribed. I hope this is helpful. I'll look forward to getting back to you next Tuesday. Make it a super week. Bye for now.